Hello, my name is Sourvinos. I'm a professor of clinical virology at the Medical School of Crete, and I'm also the director of the Laboratory of Clinical Virology at the University Hospital of Crete. My lab is a reference lab for the whole island of Crete, with a general population of 600,000 people. We need to introduce in the lab point-of-care systems and clinical diagnostic tests in order to reduce the turnaround time, to improve the workflow of the laboratory. The poster I'm presenting here has to do with the comparison between different point-of-care systems testing respiratory pathogens. And we obtained swab samples from the last winter season, and we compared the performance of 3 different point-of-care diagnostic assays. In the lab, we had already introduced one of the point-of-care systems in order to test respiratory pathogens, and we wanted to test and compare the performance of the newly introduced point-of-care system in the market last year, the QIAstat-Dx. We tested the same swabs employing both different assays, and we wanted to compare the performance, the turnaround time, and of course the results obtained, whether there were any discrepancies or invalid tests, so we concluded on that. This study showed for the first time that the performance of both point-of-care systems is quite comparable. I mean, we were able to detect the same pathogens both in terms of influenza viruses furthermore regarding the rest of the respiratory pathogens, just like RSV or parainfluenza virus, adenovirus or whatever, and they had comparable performance. So we were quite happy to test a new system and check that there are more solutions in the market, and one should think broader and test more things and introduce what the best solution seems to be for his own needs in the lab. Things are moving towards syndromic testing in general because there are many benefits from all kinds of aspects of a healthcare system. First, for the patient, of course, and also for the laboratory, the clinician, which is very important, and the healthcare unit, saving budgets, avoiding unnecessary tests, or controlling infectious and nosocomial infections as well, or facilitating antibiotic stewardship. So there are several benefits at different levels of a healthcare system. So one should think of all these advantages and introduce this test in the future in the lab. Apart from menu expression, I would hope for better prices, lower prices, and this is another issue every laboratorian discusses in private discussions. And actually, this is an issue how to convince the administrators of a hospital, especially of a public hospital, how to introduce those tests, because the cost looks quite high. But of course, if you balance the benefits towards the cost, the balance tilts towards the test and the syndromic approach. But you have to convince the administrators, and it's not that easy.
QIAGEN.
Sample to insight.